International AIDS Conference. Of course, it's happening in Durban now. As you saw, Blain Herman, he spoke there to the Health Minister. He's on standby once again to now talk to the Executive Director of the International HIV-Aids Alliance, Christine Stegling. A very good morning to you, Blain. First time I'm talking to you live, that is. Before you start the interview, just give us a quick idea. How do you reflect on the first couple of days at the AIDS Conference?
Yeah, very good morning to you, Eben. As you know, from the interview that you just played with the Health Minister, it's a crucial meeting here. 18,000 delegates over 180 countries. They're all here to assess and take stock of the global response to HIV and AIDS. Where are we coming from? There's a number of plenary sessions. There's about, 500 of the next couple of days, next 5 days. This conference ending on Friday. So hopefully we can get some concrete practical outcomes in order to take this fight against HIV forward. I mean, let's look at the numbers even. Since the early 80s, we were talking about over 71 million people that were infected with HIV. The number of deaths is sitting at about 35 million since the 80s. Currently, there's about 37 million people that are living with HIV. So this conference even has a lot of work to be done. And let's further this conversation now with Christine Stegling. She is the Executive Director for International HIV-Aids Alliance. Thank you very much indeed for your time. Tell us the pressure that civil society AIDS organizations are under at this moment.
Yeah, thank you very much, and thanks for having me. There is an enormous pressure. We all feel that this is the moment where we really have to go the last mile. We're very, very close to getting the amount of people on treatment that we need to have on treatment, but there is still a huge gap. And we are realizing from an international perspective that donors are getting less and less interested in funding the AIDS response, maybe with a few exceptions, and the US government has been quite prominent here at the conference to provide resources.
Yeah, but as we heard, they just pledged, 6 billion rand to help South Africa.
Which is great, but when you sit in the other capitals of the world, in London, in Berlin, you realize that many donor countries have either moved on to other health issues or they're having their own crisis to deal with, such as the refugee crisis.
So are you saying there's a different feel when you hear in Africa than that of Europe or other countries?
Yes, I think there's definitely a different feel. Obviously, many more people, it's much more present here in South Africa that there are more people living with HIV, and it is a big priority. But when we go across the world, we're realizing it is being deprioritized, and we realize that it is harder and harder to make the argument why the resources need to go to civil society. And for us, that is the main issue that we need to push this week. For us to be successful, we need to fund civil society.
So how do we keep these countries engaged?
I think we need to keep on showing that if they don't get engaged, we will lose this fight and we will not make the last mile, and therefore it will come back to us. We already realize, even in South Africa, 20% of new infections are in those populations who are most marginalized. And we see in countries where donors have left. So, for example, in Eastern Europe, epidemics shoot up amongst drug users, amongst sex workers. So we need to keep the pressure on, otherwise we will pay for it in a very big way in the long term.
Because that opportunity to act, that window of opportunity to act is closing fast, isn't it? Give us a sense of the importance of civil society in the fight against HIV and AIDS.
I think South Africa is the most beautiful place to talk about that. We all know how important the Treatment Action Campaign was to ensure that people had access to treatment or have access to treatment. And we see that all over the world. It is the civil society that needs to put the pressure on to make governments do the right thing, that supports people who are on treatment to stay on treatment in the long run, and to do provide prevention services with populations that governments find hard to reach. Gay men, when they're criminalized, drug users, sex workers, transgender people, and that's what the role of civil society is. And I feel for us as the International HIV-AIDS Alliance, we really believe that you need to support national civil society systems to play alongside with governments to play that role.
From your work on the ground, what do people living with HIV want?
I think people living with HIV want what most of us want, a healthy life, a life where they can engage. They want good access to medical services, not just to ARVs. I think that's also the bigger conversation. We need to be able to fix our public health systems everywhere, because whether you're living with HIV or not, you need to have a hospital that you can go to that is functional. They want access to work, they want not to be discriminated, and they want to live full lives as everybody else. And I think in many countries in the world, that's still not the reality.
Christine Stegling from the international. She's the executive director for the International AIDS HIV Alliance. Thank you very much indeed for your time. Eben, you can hear the urgency. You can see the role that civil society is playing here at the conference. Crucial role. It's crucial that these 18,000 delegates can knuckle down and map the way forward in terms of the fight against HIV/AIDS. Eben?
It is a concern, though, that funding is starting to become a little bit less. That's a concern. But Blain, thank you. We'll be back with Blain once again a little bit later in the show for more updates from the 21st International AIDS Conference, of course, taking place in Durban.